Hello and welcome. It's good to have you all here at the briefing of the staff of the Congressional Malaria Caucus as well as friends of the malaria cause. I'm Mark Green, Director of the Malaria Policy Center for Malaria No More, former ambassador to Tanzania, and a recovering member of Congress. I've been asked to fill the shoes of the Congressional Malaria Caucus's chairman, Congressman Don Payne, and to serve as MC today. I can serve as MC, but I can't fill his shoes. Don Payne has been an absolute champion in this cause, as I'm sure you're all aware, and I want to thank his staff for all their hard work, including making this room available to us today. I also want to thank Caucus co-chairman John Boozman and his staff for their help in bringing us to today and for all the great work that they're doing. It seems to me that in this briefing, our caucus, the Congressional Malaria Caucus, and this movement must answer over and over again three basic questions. Why malaria? Why now? And why us? The good news for all of you this morning is that you're going to hear first from some people who are far more qualified to answer especially those first two questions, more qualified than I am. But then I'll try to wrap up a little bit with perhaps my answer to that third question, why us? In other words, we have a great panel here with us today. First, Rear Admiral Tim Ziemer. Admiral Ziemer has led the President's Malaria Initiative since June of 2006. PMI, as I hope you know, is a historic $1.2 billion 5-year initiative to control malaria in Africa. You may not know that Admiral Ziemer previously served as Executive Director of World Relief. During his naval career, that's why he's Admiral Ziemer, he commanded several squadrons and an air wing supporting the First Gulf War. His last duty assignment was as Commander of the Navy's Mid-Atlantic region, responsible for the 11 bases providing support to the world's largest naval complex. He was born in Sioux City, Iowa, but raised in Asia, the son of missionary parents serving in Vietnam. After graduating from Wheaton College, he joined the Navy, completed flight school, and returned to Vietnam to fly during the war. We will next hear from Natasha Villamoria, who is Executive Director of Friends of the Global Fight Against AIDS, Tuberculosis, and Malaria, where she leads that organization's efforts to educate, engage, and mobilize American decision makers on the important work of the Global Fund. And that fund, of course, is a historic worldwide effort to eliminate the burden of those three diseases. Friends seeks to build a sustained commitment to supporting the Global Fund and that fight. She joined Friends in April of 2005 after serving as Senior Public Policy Officer at the Elizabeth Glaser Pediatric AIDS Foundation, and she has a very extensive background in working on global health issues. Prior to that, she spent 4 years in the Clinton administration, serving from 2000 to 2001 as Senior Advisor in the U.S. Department of Treasury, advising senior administration officials on domestic economic development issues. She also served as Policy Advisor for the National Economic Council and as a Social Science Research Analyst for the Social Security Administration, where she was a recipient of the Associate Commissioner Award for Exceptional Performance. She's a graduate of the University of Chicago and has a master's degree from the University of Pennsylvania. And then we'll hear from Matt Lynch. Dr. Lynch has worked in international development for over 25 years. Since serving as a Peace Corps volunteer in Kenya, near and dear to my heart, he spent 9 years working in rural Kenya and Tanzania on village water projects and changing household hygiene behaviors to prevent eye disease. He received his master's degree in public health from the University of Hawaii and a PhD in international health from Johns Hopkins University. He worked over 6 years at the headquarters for the U.S. Agency for International Development, including serving as malaria team leader in the Bureau for Global Health. He is currently director of the Global Program on Malaria at the Center for Communications Programs at Johns Hopkins. He also serves as the vice chair of the Rollback Malaria Partnership Board.